do this. This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber, and today I've got two fabulous co-hosts with me today. They are both friends of the show. We've got Dr. Julie Russak. She's a board-certified dermatologist, founder of Russak Dermatology. And we've got Jennifer Hanway, a board-certified holistic nutritionist, who are now coming together to create a totally integrative approach to anti-aging with this wellness program they've created. And I'm so excited to talk to you both about this. Welcome to the show.
Hi.
Hi, everyone.
I'm so excited today because, we've had both of you on the show individually. And, I think that in this day and age, we realize that beauty is more than skin deep. But why don't I let you tell me a little bit about why I know that you've both worked together in the past, but why you decided to create a true anti-aging wellness program. Let's start with you, Dr. Russak.
Well, first of all, thank you so much for having us. We really appreciate it. And it's a great opportunity for us, but also it's a great opportunity for everyone else to kind of learn a little bit about that dermatology and cosmetic dermatology is not only about injection of fillers or injection of Botox. And I think that that's a big stigma that we've been carrying for a very long time as dermatologists. What we created with Jennifer and what we want to teach our patients about is that there's more to dermatology. There's more to beauty of dermatology and cosmetic beauty than just something that me as a physician can just inject and do that. A lot of our patients really wait until they see, when they look at themselves, the signs of aging, and then the road of coming and doing the fillers or stigma of doing the fillers or doing Botox is still out there. So a lot of patients, they don't really think about talking to us about not just how their skin looks like, but how they feel. And
Right.
This area, especially for us women, how we feel, how we age in terms of feeling and old, is really pulls out of the cracks of, you don't talk to your primary care about it, you don't talk to your dermatology about it. So who do you talk about it? And that's what we wanted to do. We wanted to create a program where we really wanted to help our patients to feel and look great. And there's so much more that goes into that than just how your skin looks like.
Right. And Jennifer, you've been on the show multiple times before. So what was it about, this program that really excited you?
Sure. So Dr. Russak and I met 5 years ago now, I think, on a retreat that I was a part of the team on in Switzerland. And we started talking about how Dr. Russak's patients were maybe not making the most of their aesthetic treatments because Dr. Russak works wonders on the outside, but that inside piece, if that's missing, if they're not absorbing their food, if they have inflammation, if they're stressed out, if they're not sleeping, I mean, tick, tick, tick for all of those things, for all of us, then they're really not maximizing the results. So that's how we started. And we've been running the program for 4 or 5 years now. And just this year, we really took a step back and said, what are our patients coming to us about? We've really niched down in who we're working with, what we're working on. And as Dr. Russak said, they're coming to us for skin, but we're the ones taking a deep look into what's happening with their thyroid health, what's happening with their stress levels, what's happening with their gut health. And from that, what we can do is regenerate from the inside out.
I mean, I love that because I feel like so many of us, in some ways, I hate to say this, but a lot of the traditional aesthetic procedures that we might go to our dermatologist for are to fix things that, we've already done in the past, right? So it's like we are working to, I don't want to say put a Band-Aid on our bad boo-boo behaviors, but, we're trying to kind of fix the outside, but so much of what we do, and especially when you're doing these procedures, is really affected by your care, the other 364 days of a year, both what we're eating and also, like you mentioned, our sleep, our stress, our lifestyle habits. So you guys really, have worked together, like you mentioned before, but you found that your patients were coming in and saying, what else should I be doing? So you created an actual wellness program. So why don't you tell us a little bit about what that entails? Let's start with you, Dr. Russak.
So as Jennifer was saying before, we do a lot of different procedures in our practice, a lot of procedures to help you feel and look better. And a lot of the times, it's not only of what I can do for you, it's really what you can take from that. And what we started realizing for a certain procedure from the very beginning, that's how we started. We do procedure called L therapy, which is a collagen induction procedure. And I think that you've done it. Exactly.
I've done it with you. I love it.
So it's a procedure that stimulates your own collagen. And what we've started noticing that we do exactly the same protocol for all our patients, but the results were not exactly the same. Some respond amazingly well, like you did, and some, there's some room to be desired. So what was that we removed what we do? What was that kind of determines that? What is the variable? And once we started taking a little bit of a deeper dive, it's really what your body can do as a stimulation. If your body is not optimized in terms of its metabolic potential, what I do in the office in terms of stimulation, it's not going to give us the best results. And that's why Jennifer and I come in with our wellness program. We are really helping our patients who want to look their best to also make sure that they are able to do that their body is able to respond to all the stimulation that we are doing. And that involves really looking at their metabolic health. And what we are doing that is different from their primary care physician is not looking at that they are within normal limit, that they are healthy. Most of our patients hopefully are healthy. What we are really trying to do is trying to see how they could be at the optimal level of their health, so then they can really respond to everything that we're doing. And that involves looking deep into their metabolic potential, looking at the toxic versus non-toxic elements that could be present in their body that could be really deterring them from responding well to the stimulation. Making sure that all their nutrients and their cofactors, that everything up there, that there's a low level of inflammation, that they're absorbing all the nutrients, that they're able to build that protein that we are so much trying to stimulate.
Now, I know that Jennifer, we have talked about the tests, which I'm always like, I got to do this. I got to do this. Because you actually pointed out once that a lot of these tests that you'll do with your doctor and those levels that they're looking at are, like you said once to me, right? It's actually kind of like the best of the worst, right? Yes. It's like within normal limits, but you're comparing it to the general population, which includes really unhealthy individuals. So can you tell us specifically, so this program, it looked like to me, like it was kind of a three-pronged approach, right? So the first visit when you come in is going to be sort of this meeting you both and testing phase. Tell us some of the exact tests that we're going to be taking.
Sure. So I can jump in and start with that, and then I'll hand over to Dr. Russak. So we want to do a deep dive into health. And you've heard me say this before, Amber. Dr. Russak hears me all the time say this: test, don't guess.
Yeah.
So we know that one thing might work for me, something different might work for you, Amber, something different might work for Dr. Russak. So rather than taking blanket recommendations, let's really get down and find out what your body needs, what's optimized and what isn't. So as part of that, we're going to look at a full lab work. And when we say full lab work, we're not just looking at one metabolic marker or one thyroid marker. We're really taking a deep dive into all of those panels, because the lab work that you might get from your PCP is really very generalized. And as you said, when you're looking at those numbers, when you see a reference range on your lab work, it is the norm or the average of the US population. Now, I know personally, I don't want to be the average of the US population. And those norms, those values get changed every 3 to 5 years. So as we get sicker as a population, what is normal, when we read normal as healthy and it isn't, or what is common goes down. So for example, when I'm looking at a thyroid value from a conventional practitioner, maybe your PCP, the range I look at that is optimized is half that size. So it's literally half that, 50%. So we're looking at those markers. We're going to look at metabolic health, blood glucose. We're looking at lipid panels, inflammation, looking at thyroid health, looking at hormonal health. Then what we're doing in the office is we're looking at food sensitivities. We're looking at heavy metals. We're looking at cofactors. We know that for skin regeneration, collagen regeneration, we need so many cofactors, so many vitamins, minerals, enzymes. Then another thing that's really interesting that we're doing is we're actually looking at something called DNA methylation. So this is so interesting, so fascinating. We're looking at how Maybe some of us want to know, maybe some of us don't, how our lifestyle, our diet, our stress levels, how that has actually affect the DNA on our skin. And from that, we can then reverse engineer it.
So that DNA methyl, I'm so glad you pronounced it because I read it in your brochure and I was like, I have to remember this and I couldn't.
Mhm.
How is that test? How is that test done?
So
Is that a blood test?
that's a cheek swab. I think I'm right in
Okay.
saying that, Dr. Russak. Yeah, that's a cheek swab, and that's new to something that we're doing now. So we really want to see. I think for me, when we talk about testing, we only test if we know that it is going to change a patient's behavior. And what else is going to change your behavior? You know, we're talking about beauty and skin here. If you know that you're stressed and maybe drinking one too many glasses of wine, not getting enough sleep, if you know that those things are aging your skin more than we want to, that is a huge motivator to change behavior, I think.
I love that you also before mentioned, Dr. Russak, that you've done the same procedure on different people and have seen a vast difference in the results. So with something like collagen stimulation, is it possible to it's getting my mind thinking a little bit like maybe before you're going to invest in, sort of a pricey procedure, knowing the outcome that you're going to get based on what's going on in your body, it seems like a worthwhile investment. Are there ways to change that?
That's the reason we are doing it. So before you invest into certain procedures that are based on your regeneration, can your body actually regenerate? It's also very helpful for us to know where you are in your regenerative potential, because that can determine how aggressive versus non-aggressive we can be with our procedures. Knowing really your biological age, and that's what part of the reasons we're doing DNA methylations, it actually shows us that somebody who's, let's say, 40 years old, but they have been under tremendous amount of stress and they might not be at the best of their optimal health. We probably need to do a little bit more versus somebody who's 40 years old but has been taking great care of themselves, is really healthy, and they are biologically probably in their 30s. So we can do less and know that they can respond to those procedures much, much more. So that's how it helps us to determine really how to customize our regimens for our patients. And most of the regimens that we create for our patients, it's not that they come for the appointment and then we do something and then we don't see them for 6 months. We really, with this program, have the ability to change their biological and change their metabolic health. So then what we are recommending, they can respond much better.
Now, I love that because you're making us all realize, what we have the power to change certain things. And like you said, one size doesn't fit all, because I don't know about you ladies, but I will go on like Real Self. I love looking at before and afters of different procedures. And you see some people who are like, oh my goodness. And then you see some that you're like, wah, wah, wah. Not that impressive, but it's really good to start to think about, what are the things that we can control to help get the best outcomes. So, and please tell me if I'm wrong, but it seemed like, the first visit, you're going to meet with both of you. We're going to get all of these tests done. On this next visit, you're going to review those test results. And then right away, Jennifer, you jump in with a nutritional program. Is that correct?
We're doing nutrition, we're doing supplements, we're doing fitness, we're doing sleep and stress and lifestyle. And then what Dr. Russak is also doing is then creating that aesthetic treatment protocol as well. So it is such a 360 way of looking at it. And if Dr. Russak says, right, this is something that I want to do with this patient, but I want to do it in 3 months, can we get their inflammation down? And can we make sure that we're giving the body the building blocks for new collagen? Then I'm going to go, okay, this is what we're going to do in terms of diet. This is what we're going to do in terms of supplements. This is the nutrient IV that you could be having. Oh, and you need to be sleeping. So we're bringing down your inflammation and helping you regenerate.
That's amazing. Dr. Russak, you mentioned before Ulthera, right? Which is stimulating your own collagen production. So obviously you want to make sure that the body is primed for that. Are there other procedures, where we can kind of, let's say our behavior, our lifestyle can affect the outcomes?
Really, any procedure. Any
Okay.
procedure that we're doing it, your response is really determined by your body. a lot of procedures that we're doing right now in general in cosmetic regenerative dermatology, and I do mean cosmetic regenerative, we are stimulating. A lot of the molecules that we're using right now, even in the injectable forms, are biostimulatory molecules. We are really trying right now to understand a little bit more in terms of what we can do to stimulate your own regeneration, to give you back the ability to produce that collagen, to produce volume, to produce this fibrinous materials that gives you that very natural look that is you maintain who you are and not us creating those inflated faces that might not have any lines but don't look like real human faces whatsoever. Yeah. So I think that we all know what we are talking about, right? Our understanding, I think, of what beauty is really switched and changed a lot. We are really understanding that it's not about completely frozen face. It's not about having not one line in the face. It's really maintaining the beautiful, healthy skin, beautiful, healthy you. And how to do it, what's a better way to do it that helps your body to regenerate? Your cells know how to regenerate, except that when we start aging, when we start experiencing the outside environmental damage, things start to shift. Right. So really looking deep down into what it is and how we can change it around with our help from regenerative procedures, such as lasers, such as cell therapy, such as biostimulatory molecule injections like Sculptra and Radius. That's really what helps us to regenerate, and that determines the success.
You know, I'm laughing as you guys inside are saying this because for me, I think about Botox, and my Botox seems to wear off faster on me now. And my doctor was like, well, it's because you work out a lot. And I'm like, well, I'm not going to stop working out. So that's kind of, you know, apparently I'm metabolizing it faster. So that's one of the ones that's kind of like, I guess there's really not much you can do because we want to keep the working out. But things like you're saying, these regenerative processes really can be affected for the better by these healthy lifestyle changes. So after we've got these sort of first two, you know, test and evaluation, you know, you're setting us up, Jennifer, with a nutrition plan, a fitness plan, a lifestyle wellness, ways to reduce stress. Dr. Russak, what is a treatment protocol? Or is this sort of like, are you looking at this program as we're starting this and it is a never ending, you know, essentially journey in the best of ways?
It's the best way. It's a journey.
Right.
It definitely is a journey with majority of my patients. My most favorite thing to do is 5 years into this journey to pull up their pictures when they came in. And then we'll look at them and they look at them 5 years ago and they're like, oh, I look better right now. I look younger right now, but I still am me. And that's the most satisfying things of this journey. You're not going to stop aging. Unfortunately, this process continues, but how you age is really what we're changing.
Got it. So with this, you know, with this wellness program, who is sort of the ideal candidate for this?
Well, somebody who really wants to invest a little bit more into their long-term health. And health and beauty right now is really coming together. In the past, we kind of talk about health and wellness, and then we had beauty. And very often they were kind of not on the same page. We are really trying to bring this back together. Health and beauty should be together. If your skin is healthy, if your body is healthy, you will look beautiful. And that's our ideal patient.
Got it. And what do you think, Jennifer? Same thing?
Yeah, same thing. And I think it's important that the patient knows that this is a collaboration between us, our team, and them. So I can't get you to eat your veggies and take your collagen supplements and go to sleep, but I can support you. That's something that happens after we have those 2 big consultations. Then they kind of, the patient has me in their pocket. If they are going on vacation and they need help managing that, if they're even going to a restaurant and they want to choose something from the menu, then I'll jump onto that website and choose something from the menu for them. So it really is a collaboration. But I think what I love about this program and talking about this health and beauty and wellness is I think you put a little bit of work in and it makes it so much easier in the long run. So I'm someone who probably most of my friends and family think I'm high maintenance, but what I actually love is that I'm actually low maintenance in the mornings.
Right.
Because I have my diet dialed in and Dr. Russak and her wonderful team have helped me with my skincare, I want to be able to get up, brush my hair, put my SPF on, and I'm good to go. So I think if you take care of yourself in that long run, it actually makes you more low maintenance as you go along, and you don't have to keep doing all of the things. It's this, what I love about the treatments that Dr. Russak does is that they're regenerative. So they get better as you go along rather than keep having to have things topped up.
Which I love that you're saying that, right? So what we're trying to do is not just put a Band-Aid on the damage that you've done, but also affect maybe, so that I know when we did Ulthera, Dr. Russak, one of the benefits of Ulthera is like, you're hoping to maybe not have to have the facelift eventually down the line. If you start, taking care of this preventative medicine and doing regenerative health, you might not need to do those big procedures down the road. Okay, so right now I have to ask, because we do have listeners worldwide, is this something that's only available, clearly to have you do a procedure, they have to be in New York City, but is this program something that like you're thinking about doing virtually, or is it only in office based?
It's an excellent question. And I think that we are really evolving. We really tried to have this program virtually during our COVID years. It's a little bit hard because it's really certain consultations we can definitely do virtually, but certain blood tests and certain hair tests, we actually do them in the office.
Right. Okay. So this is really special for all you New York people, maybe worth a trip to do this. But you, like you said, this isn't really a one and done. It's kind of this continuing program. Let's talk about some of the treatments that you are offering right now when it comes to the aesthetic dermatology.
So the best part for me in terms of what we do is really that we can actually customize aesthetic treatments. Also depending on, as I said, that on your health and depending on your demands. I'll have to share with you that being a dermatologist, part of it is being a psychiatrist.
Yeah.
Because patients come and they come with all the insecurities that come with aging. And for us women, our face is our face forward. And for better or for worse, it really is a very big insecurity for us. How we age, how we present for ourselves, because that's why they come to me. There's something that they want help with. And it allows a lot of the times for our patients to really open up and talk about other things. So very often they come and they're concerned with their under eye area, but the reality of it is they're concerned that they're not sleeping, that they're aging, that they're really turning into perimenopausal, menopausal as age. So being able to offer this program to them and help them and support them is great. But in terms of the aesthetic treatments that we are doing, it is also educating our patients about not just instant gratification, but really investing more into a long-term results. So we are very often combining procedures, and the treatments that we are offering is really teaching our patients that the aging happens from the inside out. And by inside out, I'm talking about anatomy. I'm talking about bones. I'm talking about muscles, fat, and then skin.
Right.
I talk to my patients that I think about the aging face is like a well-made bed. There's a very beautiful mattress and a beautiful sheet. That combination is what well-made bed is made of. If your mattress is lappy and bumpy, no matter how beautiful your sheet is not going to help. So building up that foundation with procedures that stimulate collagen, build it up. So L therapy, fractional laser resurfacing, injectables that stimulate collagen regeneration. That's building up that foundation, that mattress. But you also have to have beautiful sheets. If they're wrinkly, if they're stained, no matter how great your mattress is, it's still not going to look good.
Right.
So procedures that address the surface of the skin, the beauty of the skin, depending on your age, depending on how much damage it is, procedures that help to resurface it. So very often we are combining laser procedures to resurface the skin with injectables also on the surface. Polylactic acid like Sculptra is one of my most favorite procedures right now because I can actually address the mattress and the sheet with that. We can build up and stimulate collagen, but we can also give you that Sculptra glow, which is that collagen from the surface of the skin. Our other very popular procedure is adding PRP, platelets-rich plasma, to a lot of regenerative procedures like lasers and microneedling. We are really kind of trying to harbor the growth factors and the stimulant molecules from your own platelets to stimulate that regeneration.
I'm also hearing a lot about exosomes lately. That's something that I saw on your treatment menu. Do you feel like that really adds when you're doing microneedling with exosomes? Does it really sort of push it over the top?
I'm glad that you brought it up. So PRP is extract or the signal molecule from your own platelets. And for some of us, knowing your biological age is very helpful, because if your biological age is nice and young, your platelets are probably nice and young. But if you're already seeing that biologically you're probably not at the peak of your regenerative potential, the signaling molecule from your own platelets probably not going to give you the best signal. So that's where the exosomes come in. Exosome is an extract from stem cells.
Right.
And stem cells is what can really create any tissue, any organ. So taking those signaling molecules from those really primordial stem cells that can send very strong signal everywhere, and using them to stimulate regeneration, either with microneedling or with injection or with lasers, is really helps us with that procedure.
Got it. So you're getting the fresh stem cells. And listen, we know people feel different ways about this. I've done exosome microneedling because I'm all for it. I'm like, give me the healthiest stem cell you got. I'm ready for that. You know what I want to, in case people haven't heard our previous podcast, Jennifer, I want to point out a few things, because I think when people think about nutrition, when they think about fitness, when they think about this idea, sometimes people are like, oh, I don't want to be told I can't have my glass of wine. I don't want to be told I can't have my dessert. I don't want to be told I have to run for an hour. I'd like you to kind of go through really quickly. Like I find that you are very a realist in people's lifestyles. But you did tell me something, and I saw it in the manual for this guide about over cardio exercising. And it makes me so happy, because I can't deal with like those long spin classes anymore. Can you tell us what that is?
Sure. And this is so funny, because this is actually how Dr. Russak and I bonded, that I very gently, in my British manner, that she was doing too many soul cycle classes, and that was ramping up her stress levels and breaking down collagen in the body and all of those things. So I will always meet our patients where they're at, because that's how we create change. Just as if we're talking about a skincare routine, and if someone has no skincare routine and you give them 14 products, it's not going to work.
Right.
Just as if I have a patient, and a lot of our patients are so busy, and you were talking about patients just being in New York, or we have patients that come from all over the US to come and see us. So they're busy, they're traveling. I can't give them some super complicated thing that they're never going to do and say that they can't go out for a glass of wine or a cocktail with their friends. So it's really about meeting them where they're at. Right. So if that means that 5 days a week, we're not going to have a glass of wine, but 2 days a glass a week, we're going to have some organic champagne or some great red wine, fantastic. Let's jump to that cardio piece, because it's so interesting hearing Dr. Russak talk about things like growth hormone. So growth hormone is something that declines as we age, and it's one of the reasons why we lose muscle. So Dr. Russak talking about, every time Dr. Russak works on my face, I'm going to think that she's thinking of my face like a bed, and I hope that my mattress isn't lovely.
Well, your mattress is looking gorgeous, and those are sheets from Bergdorf, let me tell you.
There we go.
That is from Frate Linens. Yeah. Huh?
So talking about cardio, when we do too much cardio, so for me, too much cardio is more than maybe 2 or 3 half-hour runs a week. When we do too much cardio, that's what we call catabolic to the body. So it breaks things down. So it breaks down our muscle tissue. It breaks down our collagen, because it creates so much stress. Our stress hormone cortisol breaks these down. This is why, and I think when we look at presidents, when we look at presidents and they finish their 4-year or their 8-year term, the stress in their face, it breaks that collagen down. It breaks that muscle down. So something like cardio, what I will never take, if it helps someone's mental health, if it's someone's release, wonderful. But if someone's doing it because they think they have to do an hour of cardio every day, stop it. Pick up the weights. What the weights are going to do is that's going to help that mattress. That weight is going to help you build lean muscle, which is the engine of our metabolism. We hear about juice cleanses and supplements and crazy things to boost metabolism. Nothing boosts your metabolism apart from having more lean muscle mass. It's our engine of metabolism. So strength training will give you more lean muscle mass. It also really helps promote the hormones that keep us young. So when we look at kind of all cause of longevity, we look at studies that show anti-aging, the more muscle mass you have, your younger your biological age. And what that also does is it creates wonderful things like growth hormone, which, yes, we can see if we have great legs, glutes, triceps, we're also seeing it in our face as well.
Right.
So cardio, if you don't love doing it, don't do it. Pick up some weights, go for a walk, reformer Pilates, all of those things. So much better in terms of your health.
I love that. Thank you. I wanted to give a PSA out because, in my 20s and 30s, I used to go and do all these high cardio classes. I have now switched. I do Peloton weight classes in my apartment. I've got my home gym. I'm never really lifting more. And then for a while, I was lifting super heavy weights and I was always hurting myself. Right. So I'm keeping it to heavy weights, but like not really anything over 20, 30 pounds. And it's been transformational, and 20 to 30 minutes a day. That's all it takes. You don't need to be in the gym.
Last longer.
What?
And your buttocks probably last longer.
Oh my gosh. It's like everything, because you can commit to something for 20 minutes. If I have to do a 45-minute class now, I'm like, I can't. I don't have the attention span or the interest. No thanks.
And it's so wonderful for every aspect of our biology as women. So as we get older, we lose muscle mass, we lose bone density. And once we go through menopause, we're not making enough estrogen to be able to up those things. So a lot of our clients, patients are coming into us in 40s and 50s. What we really want to do is make the most of that time of strength training and managing our stress, because that helps us get through menopause so much easier. Menopause, yes, it's a huge change and shift for women, but it should not be this life-disrupting, life-turning upside down thing that we see nowadays. So if we can get our patients in their 30s and 40s and 50s getting great habits like managing their stress and not doing too much cardio, it's going to help them in the long term.
I love this. I love that you've put this together. And it seems to me that really what you're doing is taking a very scientific approach to aesthetic medicine, right? So it's not just like, well, I feel this way. You're actually looking at biological markers. You are looking at aesthetics from a very technical standpoint. So now let's talk about, like, if somebody's interested in this, what is the process for signing up for this? How much does it cost?
So probably the best person to answer that question is not on the call today. So I would say that what the best thing to do is if you contact Dr. Russak's office, and you'll have a call with some of the wonderful team there. If you have questions, I'm always happy to jump on a call and talk to people if it's a good fit, because I think sometimes it's like, as you say, oh my goodness, am I going to have to change everything? And it's really helping people understand that this can be a good fit for you. And by the way, there's no good time to start. If anyone's listening and thinking, oh, I'll wait till after the summer and the new year, we know that things don't calm down.
Right. Never do.
There is always now is always the best time to start. And we will always meet our patients where they're at with their busy schedules. So I would say number one is to contact Dr. Russak's office, have a chat with someone there. If they want to come and then chat to me, I always jump on a call with them. And that's always the best way to take it from there.
Can I ask, Dr. Russak, obviously, depending on the aesthetic treatment protocol, those are going to be, I assume, billed at a procedural price. But is there sort of a, just so people listening, is there a general sort of intro pricing structure that you can share with us to get the testing, to get the sort of this going?
So it's a very customizable program in terms of we really have to meet with the patient in terms of determining what is the testing that is right for them. And that's what's great about it. It's not one size fits all.
Okay.
We do some of the blood work. We can send it through the insurances.
Okay.
And
but like ballpark, where are we starting?
Ballpark, we're starting around, I think it's $3,400.
Okay.
And that's all of our services. We will say that some of those tests have to go through their insurance. So, but our office will help with that. So we can't say for definite what the copay for the insurance will be. And I think the other thing that Dr. Russak, you can talk more about this, is we almost have this VIP membership for treatments. that comes with the program as well. Yeah, I know. Don't you love a VIP? Like, cool.
So
and
what? So tell us about that. And listen, $3,400. I'm glad that as sort of a starting reference, because I don't want people thinking on this, boy, that sounds like it's something, because that could be in the tens of $20,000, $30,000 to start. And I want to make sure that people realize this is an affordable investment. And also, it might be worth it to get these tests again before you're investing, in thousands, tens of thousands of dollars of procedures that might not give you the optimal results. So thank you. And I get that it's customizable. I get that it's, going to be on a per person basis. Certain people might need more, certain people might need less, but thank you for sharing sort of ballpark ranges.
Yeah.
Tell us about the VIP. Tell us about that.
So
what is that, Dr. Russak? Yeah.
So the patients that go through this program, as we discussed it, for a lot of the times they're doing it so we can then create this beautiful aesthetic plan for them. And the VIP program is for patients that went through the program, and then every month they can take advantage of certain procedures that they can do while they are under the program. And it lasts for about a year.
Wonderful. Okay, great. So it sounds to me, if you are, in the New York area or willing to travel to the New York area, if you're really interested in your own body's scientific makeup to find your biological age, not just your chronological age, if you want to sort of approach this wellness journey and invest in yourself, this is a fabulous way to do this. You're going to have both the aesthetic medicine, you're going to have the holistic nutrition in sort of this 360 approach to beauty. I love it. I want to thank you ladies both so much for joining us. Before I let you go, Dr. Russak, if people want to get in touch with you or your office, where do they do that?
Russak Dermatology Clinic. That's, if you Google it, that's probably the easiest way to find it. And then we have all our addresses. We're located at 115 East 57th Street in New York on the 12th floor. And our phone number is 646-873-7546.
And I have to say, it's one of the most gorgeous offices I've ever been in my entire life. And Jennifer, we've got to give you a shout out because you have such a wonderful presence on social. If people want to learn more about you and look at a nutritional journey, where can they do that?
Yeah, so it's easy to come and find me at Jennifer Hanway on Instagram. That's always the best way to reach out. And if you missed that phone number, come over at Jennifer Hanway, and then I can help them in the DMs talk about this program as well.
I want to thank you both so much for being on with me today. So excited about this. And of course, if you have any questions that you want me to push to either Dr. Russak or Jennifer, I'm absolutely happy to do that. You can reach me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and right here on YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye, beauties.
Bye.
Bye. Thank you.